Walmart is reportedly in talks to buy Humana as retailers increasingly enter the health insurance sector. With us to discuss, Dr. Janette Nesheiwat and Dr. Mike Varshavski. Dr. Mike, Mikhail, Mike, let me start with you.
Yep.
I think what people are really concerned about or thinking about here is, what does this mean for me? What does this mean for me as a consumer as these big mergers happen and perhaps ultimately whittle down the options to just a handful of companies, because often that means higher prices.
Yes. So the promise that we get when we see these types of consolidation is that you're going to have lower costs and improved quality. And over time, when we've seen these M&As come to fruition, we've seen higher costs and no improvement in quality. And now what these companies are doing is they're doing something known as vertical consolidation. They're merging two different industries together. So pharmacy with an insurer or pharmaceutical with a hospital system. And there's a reason why that's dangerous. They have three types of companies that are involved in taking care of patients' medication: the pharmacy, the pharmaceutical company, and the insurer. Now, in the midst of all that, you have a pharmacy benefit manager involved, which is something not many people know about, that's trying to negotiate prices with the pharmaceutical company on the notion that will save money for the patients,
right,
when in reality they're making billions of dollars with no pricing transparency, and sometimes the patients are required to bear that cost.
So Dr. Nesheiwat, could Amazon be the difference here? Because they've sort of prided themselves on taking market share by being the low-cost provider out there. Their emergence in this industry, could that now sort of change the dynamics that in the past we've seen, not just in this industry, but almost every industry where there's been consolidation, we've seen prices go up?
You know, it certainly can have a major impact. I was suspicious about the pursuit of profit with Walmart wanting to merge with Humana, but my number one concern, my number one priority is, we all know that Walmart has been known for their low costs and their low prices, but will that translate over to my patients and allow them affordable, accessible, good, high-quality health care? Not just accessible health care, but is it going to be expensive, or are they still going to have high deductibles and high premiums and high copays?
Is it too early to know that?
I think it is too early to know, and this is just in the talks. It's not definitely set in stone yet, but even this morning I have patients, you know, questioning and being concerned about their deductible and will their insurance cover their chest x-rays, there's a possible pneumonia. It's really heartbreaking, but I hope that this is actually a step in the right direction and can allow better quality care and accessible and affordable. That's the priority.
Gerri Willis has joined us, and Gerri, you know, there's all kinds of different angles to this, right?
Right.
There's the stock market angle, the business angle, the consumer angle, healthcare, obviously a big issue in this country. What are your thoughts?
So here's the deal. This deal is not a deal yet. Walmart telling me last night that they don't respond to rumor or speculation. They're not weighing in yet, but they're said to be talking, and everything's on the table. Understand, these are two companies that already know each other very, very well. They're already doing business together to offer Medicare prescription drug plans to Medicare patients, and that is a good deal. If you're getting your Medicare from Humana and Walmart, and you buy it at a Walmart pharmacy, and there are thousands of them across the country, you're paying as little as $1 per prescription. The only deal is you have to buy it from a Walmart. Could this be good? I think it could. And you know what I think it makes a lie of? This idea that Amazon can conquer absolutely every industry. Walmart is much further along in the healthcare industry. And as you know, they've negotiated in 6 different locations for their own workers to have healthcare coverage without an intermediary, without an insurer. So clearly they brought costs down there. The question is, what will they do nationally?
So then, and the impact, you know, for the patient. We talked about the business side. What are your concerns for the patient?
My worry is that when you have these mergers, you have a lack of transparency. And when you have a lack of transparency, it poses a very difficult question for patients. They don't know where they're getting the best deal from because they don't know what they're paying for. The idea of paying for medicine is that it's an industry of need as opposed to an industry of want. For example, if a toy manufacturer makes too high of a price for a toy, consumers don't buy it and the market adjusts.
Right.
But in a market of need like healthcare, where patients can't choose to not buy their insulin, they need the insulin to stay alive, they will pay whatever price is set forth by these companies. So it's important that we have the transparency to know what we're paying for.
But what do you mean by transparency in this particular case? And isn't it better to have more players rather than fewer? It seems the fewer fewer players you have, the higher the prices are going to be. The idea that Walmart, which is always a low-cost provider in every market it gets into, is jumping in could be ultimately a good thing.
Yeah, I pray that it's going to be a good thing, but Humana does have a PBM on board, meaning that they're going to start...
Pharmacy benefit manager.
A pharmacy benefit manager that's going to be negotiating with the pharmaceutical companies and making money for themselves at the same time. The question
Taking
is,
a share of the profits.
I want to know how much of the share of the profits they're taking and through what means. Because right now, this is crazy, and this is very important to say. A patient can go in with insurance and pay more of a copay for a medication than if they were to come in uninsured and pay cash, and that's ridiculous.
But that's the goal. The whole purpose of the merger is to lower the cost. And Walmart already has walk-in medical clinics in many of their centers, and they already have the pharmacy. And Humana is targeting, already looking at acquiring and opening up a chain of primary care clinics. And so that looks like it could be a beautiful marriage of these two companies, and hopefully will allow lower cost, value-based, medical care is what their goal is. And
so you're optimistic then?
I am, and especially Humana is really well known to target senior citizens, Medicare. Every day, about 10,000 people turn 65 every day. And so they're really strong with the senior citizens and Medicare packages, and that's growing. And so this is the ideal time for this merger to happen as we're seeing more senior citizens.
And even though it's not a done deal, Gerri, we do know the dynamics of the industry pointing to these sort of mega mergers because all of these companies are bulking up to compete.
CVS, Aetna, they're trying to do a deal right now. Big questions, though. Even though the structure of the deal seems good, can these go forward without the U.S. government saying, hey, that's non-competitive, we can't do that? But something's got to give, something's got to happen, because there's only one direction that these prices go, and it is up.
Yep.
Well, we need a shakeup, because by the end of this year, we were going to have a 10% increase in our premiums already, which is planning on happening. So
thank you all
something has to be done.
very much. Really appreciate it.
Thank you.